Everyday life's happening. Some days are more eventful. Others, living protected with insurance you can depend on changes your life for the better. We insure the people and things you care about. Not Agency. We'll help you find the right coverage so when life happens, you have the right insurance protection for your family and business. When life happens, live protected. Agency for all your insurance needs.
Good morning and welcome to Radio Friends on Tuesday, May the 10th. I want to introduce you to Dr. Chad Kraus, who is with us from MU Healthcare Emergency Medicine. Good to have you here.
Thank you for having me.
We're going to talk today about falling. And I asked you, I said, who are the people that fall most? And you said, little people and old people.
That's correct. So, and as we talked off air, falls are most common in old people, and which we call elderly.
Okay, elderly. And then I was trying to get it out of you now. Who do you consider as old people?
So the Centers for Disease Control.
Be careful with what you say.
Defines old people or elderly as greater than 65 years of age.
65 or older,
correct.
You're considered elderly. So I fall into that category.
That's correct.
So when you're talking to people like me, you say, be careful about falling. Why do people 65 and older fall more often?
So, well, the reason that falls are so important in that age group is it's the leading cause of death and injury in those.
Leading cause of death?
Absolutely. In those older
Falling?
than 65, absolutely. And it's also the leading cause of loss of independence and independent living.
Yeah.
So not only is it a leading cause of, like, as I said, death, but injury and loss of independence are really important.
It's more difficult for your bones to heal the older you get, right?
That is correct. So bone density is one issue. And as you mentioned, there are reasons that the elderly tend to fall more. Some of those issues being medication usage, as well as things around the house. So throw rugs, pets that folks trip over, poor lighting, a loss of balance and vision as you age are all really important things.
So what is the most important thing that you can do to prevent falls?
So the most important thing actually is to stay active, to keep the bones strong, to keep your body in as healthy shape as possible.
When you say stay active, what do you mean by that? Is weightlifting important?
Weightlifting could be, but even going for a walk around the block counts as being active. So the more you move, the better.
Okay. So if you're old, and he's looking at me, if you're and the more active you are, the better off you're going to be.
That's correct.
And the less likely that you're going to fall.
That's correct.
You can never be too active, can you?
That is correct.
Okay. If people want more information about fall prevention, can they call you, or is there a website to go to?
Absolutely. So they could go to the Missouri University Healthcare website. Would be one place they could go. The CDC, the Centers for Disease Control, has a lot of really good information, as well as tips for family members, as well as individuals about how to make their homes more safe, how to make sure that they're not on medications that are putting them at a higher risk for fall, et cetera.
What about drinking warm milk or eating yogurt? Is that going to help your bones?
Well, I don't know that that's as important as exercise. I don't think it hurts, but probably not as important.
But exercise is the most, and even just taking a walk.
Absolutely.
Okay.
Absolutely.
All right. You heard it from the doctor's mouth there.
Thank you.
Old people and little people. I could fall into both categories. Thank you so much, Doctor.
Thank you for having me.
Pleasure meeting you. You're new to Columbia.
Likewise.
You've been here about 6 months,
That's
right?
correct.
Okay, it's good to have you here.
Thank you.
Now, I want to we're going to turn to two guests that I have on my left. KERRI Burrowls from Second Chance. Good to have you here, KERRI.
Hi.
And you brought along your new director, right?
I did.
Yeah.
Yes. This is Kathleen McKinney.
Welcome, Kathleen.
Thank you.
Good to have you here. When Valerie Chafin left, there was an interim there. You stepped in and became the director of Columbia Second Chance,
Yes.
but your intentions were never to become the permanent director,
Nope,
right?
nope. I'm actually leaving the city this summer, so I couldn't stay forever.
So, and Kathleen, you come from where?
Well, I've been volunteering with Second Chance actually for a few years now, so I'm,
So
I'm
you're
an insider.
familiar with the operation of that
I
wonderful
am.
organization.
Yep. So I applied for the job during our round of interviews in March or April, I think. And they just informed me that I got the position last week, so I'm looking forward to getting started.
Tell me why you feel so enthralled with Second Chance, why it's such an important organization to you. Obviously, it's important that you were volunteering, and now you're the director, or will be the director.
For sure. I mean, animal rescue in general has always been a part of my life and something I felt strongly about. So when I moved to Columbia, I knew I was looking for an organization to get involved with, to volunteer in fostering. I really love fostering. And so I looked at all the organizations around town, and Columbia is really lucky. We have a lot of fantastic animal organizations. Second Chance was really appealing to me because of the way that they utilize their volunteers. It's a very volunteer-run organization. And yet it kind of stands apart for how well run it is. So that's why I chose to get involved with Second Chance as a volunteer originally. And I've loved working with all of the people that I've met at Second Chance. I love our mission and what we do for the community. So I just felt like this was the right step for me to take.
Now, you're always looking for foster parents
Absolutely.
for the animals, right? How many cats and dogs are you housing right now?
Depends on the day, but it's usually between 120 to 150.
Cats and dogs. You have more dogs than cats?
More cats than dogs.
More cats
They're much
than dogs.
easier to house.
Most of the dogs do end up in foster care, correct?
All of the dogs are in foster care, and all of our cats they start out in foster care at some point, and then if they age out of their foster home, or if they're adults when they come in and they're healthy, then they go to our adoption center.
So all the cats that come to Second Chance are in foster care first? What is the criteria for adopting a cat? Somebody listening to us, and let's say they found a stray cat, and they call you and say, I've got this cat, I can't keep it. Can you accept the cat? What happens?
So we take animals based upon our capacity to care for them. So it's not just whether or not we have a foster home space available. It's whether we can medically care for the animal if the animal's injured, or depending on the age of the animal, or with cats in particular, the color of the cat. So there's lots of theories about adoption and when people adopt and how many choices they have, and if they have too many choices. So if we have 45 orange tabbies, then it might be hard to take on another orange tabby. Maybe we need to take a black cat next. So there's lots of things that go into our calculation on whether or not we have the capacity to care for an animal.
If people want more information or they want to adopt, how do they get in touch with you?
Go to our website, www.columbiasecondchance.org.
Okay, if they want to make a donation, they can make a donation there too.
Absolutely.
KERRI, thank you so much, and Kathleen, it's a pleasure having you
Thank
here.
you.
Best of luck with your new position.
Thank you.
Okay? We're out of time for today. Tomorrow, Missouri River Regional Library and Marceline Railroad topic. Our program directed by Travis McMillen, Reynolds Journalism Institute Audio. Pat Akers, KBIA. Our floor director, Ariel Sierra, and Uncle James Mauser, our assistant producer. Bye-bye.